What is the single best blood pressure medication that you can use in order to reduce high blood pressure? Does one even exist? Well, those are the two questions that we will be answering in today's video. So I've talked several times about different ways in order to naturally reduce blood pressure, or how to reduce blood pressure using certain physiologic tricks. But what if you've tried all that there is within the natural route in order to lower blood pressure and your blood pressure is still elevated? This would then require a medication to use, and so is there a single best medication to use that gives you the most lowering of your blood pressure while being the safest option that you can do? Well, the answer is yes and no. First things first, blood pressure is the force of blood pushing against the inside walls of arteries. Now, there's a couple of different ways that you can increase or elevate blood pressure, and this happens naturally given stressful situations, such as running from a tiger or a bear, which hopefully none of you are right now. The first way you can increase your blood pressure is you either make the tube smaller. Decreasing the tube radius will exert more force from the fluid within them. The second way that you can increase blood pressure is by increasing the amount of fluid within the walls themselves, thus increasing that pressure. It's important to understand these couple of concepts because reverse engineering this line of thinking are the ways that major blood pressure medications work. The major blood pressure medications are broken down into two major classes. The first two medications essentially work by widening or increasing the width of the blood vessels, which would lower blood pressure overall. These two classes are calcium channel blockers and ACE/ARBs. The most common calcium channel blocker that we see used is something called amlodipine, and the brand name of that is Norvasc. ACE/ARB most common medications that we see are lisinopril and olmesartan. The major difference between these two classes is that amlodipine, or the calcium channel blockers, simply just dilate the blood vessels themselves, whereas the ACE or ARBs, the lisinopril or the olmesartan, these medications work and activate something in the kidneys that is released in the body that causes the widening of these blood vessels. The second major class of medication can be thought of as water pills in a way, and this is something called hydrochlorothiazide or chlorthalidone. Again, this works by helping you pee out extra fluid, reducing the amount of fluid within those blood vessels, ultimately lowering blood pressure. All of these medications are actually pretty safe, but they do come with their own unique and specific side effects. Certain classes of medications as a whole are better for pre-existing conditions. For example, the class of medication, the ACE and ARB, a lisinopril works better for individuals with diabetes, as these medications tend to have sort of a protection mechanism around the kidneys. I personally think the best blood pressure medication that you can go with overall is amlodipine. I think this is the best medication that you can do because unlike some of the other medications, this medication has a very simple mechanism of action. It lasts almost a full 24 hours, and you don't have to do additional lab work like monitoring certain kidney functions, as well as your electrolytes that you have to with some of the other medications. Also, I think the side effect profile of amlodipine is probably the least dangerous overall, and I actually did a video on this going into the specific side effects of amlodipine that you want to look out for. So if you want to know more information of that, I would recommend clicking on this video here.